Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks if I can explain the difference between borderline personality disorder and bipolar disorder, and specifically looking at bipolar II disorder. Because bipolar II disorder can be easily confused with borderline personality disorder, and bipolar I disorder, it's a little easier to see the difference between the two. So in this video, I'm going to go through these two disorders, kind of looking at multiple domains and trying to explain how to differentiate these disorders by these domains. So before I get there, let's take kind of a quick look at this problem. We know that bipolar disorder and borderline personality disorder both have potentially devastating outcomes. We see increased mortality with both disorders. That means the risk of dying is higher. We see a poorer quality of life, relationship difficulties, problems at work, and a number of other difficulties. There are many differences in the treatments as well, so it means that we really have to be careful in diagnosing the correct disorder. So differentiating between the two is actually clinically important. For example, bipolar disorder doesn't typically have any type of personality component associated with it. And of course, borderline personality disorder is a personality disorder. It's a collection of extreme personality traits. That's how we think about personality disorders. So the way we go about treating these disorders could be quite different. So again, a misdiagnosis could come at a great cost. Now, this misdiagnosis risk isn't just theoretical. We see that 40% of individuals who meet the full criteria for borderline personality disorder, meaning they meet enough of the symptoms to have the diagnosis, but who do not have bipolar disorder, were previously diagnosed at some point with bipolar disorder. So this confusion is actually quite common. Now, these two disorders are difficult to differentiate for a number of reasons, but two of the reasons I hear a lot would be the comorbidity. This is the co-occurrence of the disorders. So we see that somebody can have bipolar and borderline at the same time, and these two disorders tend to be comorbid with similar disorders. So for example, bipolar disorder has a depression component to it, and borderline personality disorder is highly comorbid with major depressive disorder. So the comorbidity can really be tricky here. And the other area really centers around the similar symptom profiles. So if we just look at the symptoms for each of these disorders, they seem similar. Now again, as I mentioned before, someone can be diagnosed with both, but that's not extremely common. It's more likely that somebody would have just one or the other. Now, specifically looking at the comorbidity, we see that about 30 to 40% of individuals with bipolar II disorder who are in remission do tend to manifest borderline personality traits. That doesn't mean they necessarily have BPD, but they have traits of BPD. And what we see specifically in terms of the traits that would stand out, that would be quite common in individuals who have bipolar disorder who are in remission, we see chronic feelings of emptiness, anger, and relational difficulties. Now, we also see that when looking at studies of individuals who have bipolar or borderline personality disorders, if we look at those participant groups, about 10 to 20% of those participants have both disorders. So again, the comorbidity of these two disorders isn't extremely common, but it is there. We see this 10 to 20% risk in these populations anyway, that somebody might have both. Now, I mentioned before they have similar symptom profiles, but we have to consider more than just symptoms when trying to differentiate borderline from bipolar. If we just look at the symptoms, it'd be actually quite easy to make a misdiagnosis. So I'm going to look at the symptom profiles, but we also must consider etiology and course. So this is what I talked about before when I talked about breaking down the domains of differentiating these disorders. So I'm first going to take a look at the symptoms, then take a look at the etiology, and then take a look at the course, and try to offer tips in terms of telling these two disorders apart across all these domains. So starting with symptoms. With borderline personality disorder, BPD, we see 9 symptom criteria: frantic efforts to avoid abandonment, an unstable relationship pattern, identity disturbance, impulsivity, suicidal behavior, affective instability. This is emotional dysregulation. We see chronic feelings of emptiness, inappropriate or intense anger or difficulty controlling anger, and paranoid ideation or severe dissociation. Now, with bipolar disorder, we see really symptoms of depression and mania both. So I'll cover several of these, but I'm not going to go through the entire list for both depression and mania. So with the depressive side, we see symptoms like prolonged periods of sadness, trouble sleeping, like sleeping too little or too much, social withdrawal, feelings of worthlessness, difficulty concentrating, irritability, frustration, anger, and crying for no obvious reason. On the manic side, we see elevated mood, increased goal-directedness, a lot of energy, rapid speech, impulsivity, grandiosity, like we might see with narcissism, irritability, aggression, poor judgment, and not sleeping. Now, with both the depression and mania side, we see a risk of self-harm, and sometimes we see paranoia. That's because for some people with bipolar disorder, they also have delusions and hallucinations. We would not expect this with borderline personality disorder. So if we look at the overlap here between bipolar and borderline, and we include associated features, so the symptom criteria and the associated features, we see quite a bit of commonality. Feelings of worthlessness, sadness, irritability, anger, aggression, crying, impulsivity, poor judgment, and thoughts of self-harm. So those could appear again with bipolar or with borderline. Now, the depressive side of bipolar may not be as useful for differentiating the two disorders from one another as much as the manic side would be, right? Because there's many similarities between depression and borderline. Specifically, we see a lot of similarity around that chronic feeling of emptiness. That happens in depression and, of course, in borderline, although the chronic element we expect more in borderline personality disorder. But there are a few things about the depression that can help us differentiate. For example, with the unexplained crying. With borderline personality disorder, somebody with this disorder would probably be able to give a clinician a reason for the crying. Whereas, of course, with bipolar disorder, somebody might say they just don't know why they're crying. That's one difference. Now, another difference here would be around the difficulty concentrating. Borderline is not typically associated with that symptom, and of course depression is. And when we look at the sleep disturbance, of course we can see this in both disorders. But with depression, the sleep disturbance sometimes is really pronounced. When we treat people who have depression, a lot of times we see that they can sleep for a long period of time, like 18 hours, 24 hours, sometimes multiple days. That type of sleep behavior would be a little bit unusual with borderline personality disorder. Now, when we move over to the mania, we see this is actually a main distinguishing factor. So the mania does help us differentiate bipolar from borderline, specifically the elevated mood and increased goal-directed activity component. We would not expect to see those with borderline, so they're actually really good distinguishing factors. Now, we also have some other potential differentiating factors like rapid speech and a lot of energy. That would be somewhat rare in borderline personality disorder. And when we talk about the sleeping, I talked about how the sleeping is different for depression. It's also quite different between mania and borderline. One thing we see with individuals who are manic is they can go without sleep for days at a time. That's, again, somewhat unusual for borderline. Now, looking at this in another way for a moment, let's look at the borderline symptoms that we wouldn't expect to see in bipolar. And the one that really stands out would be frantic efforts to avoid abandonment. We just don't see this in bipolar disorder very often. Identity disturbance is one as well. It would not be too common in bipolar disorder, but it's kind of tied to self-image, so it's a little harder to figure out sometimes. So you could be talking to somebody with bipolar disorder and say, do you have difficulty with self-image? Do you have identity disturbance? And they might say that they do because at that time they feel like that. But if you ask them multiple times, if you see them for like several months, it would be unusual that they would always have that component. Whereas with borderline personality disorder, you would probably more consistently get an answer of endorsing some sort of self-image problem. Now, with borderline, we also see this affective instability symptom. And this one is a real problem because it's so similar to what we see with bipolar disorder. But there is an opportunity here to differentiate. When looking at the specific symptom with borderline, we usually see irritability, frustration, aggression, anger, and impulsivity. Whereas with bipolar disorder, it's more likely that we would see like euphoria and depression and moving back and forth between those two. So this affective instability symptom, again, is really tricky, but there is a little bit of an opportunity to help tell the two disorders apart based on the characteristics of the symptom. So that covers symptoms. Let's take a look at the other domains now. Let's move to etiology. So what etiology means is what causes a disorder. And of course, we don't really know what causes mental disorders, but we have an idea about some of the risk factors. So the first element in terms of etiological factors that may be helpful in differentiation would be a trauma history. So with borderline, we know that about 50 to 80% of people with this disorder have a history of trauma, and for bipolar disorder, it's around 15%. So a fairly large difference there. Another etiological component that might be different would be self-harm. For borderline personality disorder, we see that 85% of people with this disorder engage in self-harm behavior, and only about 50% of individuals with bipolar do this. So there's not as big a difference there, but there's still a difference. Now, when we look at suicide attempts specifically, we see that about 60 to 70% of individuals with borderline will attempt suicide. So it's really quite high there. And for bipolar disorder, it's around 30%. So moving on to family history, this is usually discussed in the context of etiology. We know that a family history of bipolar disorder is twice as likely in somebody with bipolar disorder as opposed to borderline personality disorder. But interestingly, a family history of depression really tells us nothing useful in terms of differentiating, because it's just as likely in somebody with bipolar as it is in somebody with borderline personality disorder. So now moving on to course, this is the last domain I'll look at. With bipolar disorder, we see that this disorder tends to worsen over time. We see more depressive episodes and fewer hypomanic episodes. Now, borderline personality disorder actually tends to improve with age. About 80% of individuals with BPD will see a significant improvement over the course of 10 years. Now, we have to be kind of careful with this, though, because a lot of the personality characteristics are still present. It's just that the individuals don't meet the full criteria for the actual diagnosis. So they could still be suffering quite a bit, but just fall short, again, of the diagnostic criteria. But still, in general, bipolar can tend to get worse in some ways, and borderline can tend to improve in some ways. Another difference around course is that bipolar disorder has an episodic component to it. This means that we expect somebody to be depressed and then to have another mood episode like mania, or perhaps be depressed again. And the same thing can happen if we start off with mania. They could go to a depressive episode or go on to another manic episode. But either way, we expect it to be episodic. Somebody's going to cycle in and out of episodes, regardless of the polarity of those episodes. And during those gaps, we would expect relatively few symptoms in most presentations. With borderline personality disorder, again, it's conceptualized as a personality disorder, so it's considered to be more stable. So we wouldn't expect to see the same kind of cyclic nature over time. Now, when we talk about prevalence, this is often under course as well. Prevalence actually doesn't tell us much in terms of differentiating these two disorders. One of the reasons is because the figures are all over the place, but when we look at some of the good evidence in terms of prevalence, we still really don't get much help there. With bipolar disorder, the prevalence is around 1 to 1.5% of the population, so about 1 to 1.5% of the population will have bipolar disorder. And with borderline, it's around 1.6. So again, it really doesn't tell us much. Another element with the course here is to look for triggers. I think this is particularly important when trying to differentiate these disorders. So for example, you want to ask about what's causing the symptoms in terms of relationships. So ask a client what they think is bringing the symptoms on. So if they talk about feeling alone or having fears of abandonment, or they talk about self-harm, that kind of points more toward borderline. If the anger is in the context of a relationship, that points more toward borderline. But if the individual is kind of angry with everybody, including strangers, that really doesn't help too much. That could be borderline, but that could also be bipolar. In terms of triggers, you also want to look at the effects of relationship stress, like the timing, like do the symptoms come about when somebody has a relationship that ends? Does the client feel like they're better when they're not in a relationship at all? This may point more toward borderline, because with borderline personality disorder, people with this disorder really struggle in relationships. So they may find that when they don't have a primary romantic relationship, for example, they're not really feeling as much in terms of the symptoms. Now you also want to look at the history of romantic relationships specifically, like the pattern. So is there a long string of failed romantic relationships? Now this can happen with both, but you have to ask, why did the relationship fail? If it failed for a lot of the symptoms really of borderline personality disorder, again, like frantic efforts to avoid abandonment, like stalking, for example, that strongly points toward borderline. If the romantic relationships ended for other reasons, that could point more toward bipolar. Like, for example, if symptoms that are similar to a manic episode really caused a lot of stress in the relationship and caused the relationship to end, of course that would point more toward bipolar. So there's a lot of different factors to consider, again, with the relationship characteristics and the triggers and what is causing stress for the individual. So in trying to tell these disorders apart, again, consider symptoms, etiology, course, and in that course include triggers. Now, I know whenever I talk about topics like this, borderline personality disorder, bipolar disorder, and kind of how we figure out what disorder somebody has, there are going to be a lot of different opinions, people who agree or disagree with me, or who have other thoughts based on their experience with the disorder, or seeing a family member who has the disorder. So please put all these different opinions and thoughts in the comment section. They usually generate a really interesting dialogue. As always, I hope you found this description on how to differentiate bipolar and borderline personality disorders to be interesting. Thanks for watching.